about the system, not just a city, not just it talks about the entire system, and then it talks about the board of directors. Well, that board of directors is going to cover the system, not
That's right.
whether it's a small city or whether it's 5 cities. It's going to cover the entire area. So I think your bill is very clear.
I do too, and in the fact that there, that just question is just being brought up right now. I mean, this bill's been filed out there a while. It's even been amended, and so there's been plenty of time for somebody to come with this concern. This fluoridating issue is not a new issue. It has started back in 2011, so this is not like it's just a totally new thing that's been popped on anybody. This legislation has been out there and filed a while. This was not a shell bill. It has just been filed and the language filled in right before surprise anybody.
Any other questions from the committee? Seeing none, before we start, we've got a lot of people signed up to testify. Some of you, no doubt, have come from far corners of Arkansas. I'm going to start at the top of the list, but in case we get into debate and take up a lot of time on down the line, we could end up limiting debate. So I'm going to start at the top of the list. If you that are for or against know each other and have key people that you would want to be sure that are heard, you should visit and make sure that that happens. Otherwise, I'm going to start with against, and Larry Lloyd, Beaver Water District, it looks like.
If I may, I'm going to defer to Representative from Delta Dental.
Good morning, Mr. Chair, members of the committee. My name is Ed Choate, President and CEO of Delta Dental Arkansas.
Okay, you're recognized.
Thank you, sir. I realize this is a local control issue. The reason we're opposed to that is because we look at it more importantly as a public health issue. So I'd like to speak to the merits of the public health because I think that should be the overriding concern of this body. I'm here to speak to one of the most important and most time-proven methods of improving oral health that we've seen at any time in the last 70 years. Community water fluoridation is a public health matter because it is so safe, easy, and effective. And it can help almost all Arkansans. Currently in the United States, about 75% of the population is on fluoridated water systems. And they're fluoridated to the optimal level of fluoridation. And the reason I want to focus on optimal is because fluoride is a mineral that naturally occurs in our water, whether it's lakes, streams, or groundwater. All we're doing when we fluoridate water systems is adding a little more fluoridation to get it to the optimum level for public health and safety. The CDC and EPA have agreed that 0.7 parts per million is the safe amount for our water systems. Delta Dental supports water fluoridation because it's central to our mission. Our mission is to improve the oral health of all Arkansans, not just those with a Delta Dental card in their personal wallet, which by the way is about 500,000 Arkansans. But instead, we want to benefit all, regardless of their age, their income, or their geographic area. In particular, we want to help families that don't have access to preventive health services because of money or benefits or just simply geographic access. We want them to have the benefit of good public health just by being able to drink fluoridated water. You may be wondering why that is such an important issue to us. It really does come down to the health of Arkansans. We are highly motivated to do the right thing and are willing to take courageous steps to do it. We realize this is a controversial issue. Back in 2011, when this body was considering Act 197 and was considering passing a mandate, we were asked, Delta Dental was asked to cover the initial capital costs for reasonable startup expenses to fluoridate water systems. I asked then how much that would cost, and I was given a very engineering-specific answer about it would cost about $500,000. I went to our board of directors, asked for approval, and received it. I'm here to tell you now, 6 years later, we have spent just under $7 million providing startup capital for the fluoridation about 30 water systems in Arkansas because we want to do it right. Not just do the injectors, but the buildings, the safety features, everything is necessary to make certain that we don't just fluoridate the water, but we do it exactly right so that the members of these water systems have optimal fluoridation. Under the direction of the Department of Health and Department of Oral Health, I'm also very proud to tell you that Arkansas has risen from 65% of our citizens with fluoridated water to 89%. Now, if you remember earlier in my testimony, I said 75% of the people in the United States have fluoridated water, so we were just below the average, which sadly Arkansas ranks in that state too many times when it comes to vital health information, vital health metrics. We are now one of the top in the country. Please don't reverse that. Please don't. It's too important to the citizens of our state, especially children. So I'm asking you to make the right decision for public health, and oppose this bill. And I'd be happy to answer any questions you may have.